Dunya چھُ واریاہ تیز پَکان ڈاکٹر صٲب آز کل لُکَن چھُ واریاہ سٹرٛٮ۪س ریسپانسِبلٹی چھِ واریاہ لُکَن تُہۍ چھُو وٕچھان لُکھ چھِ آسان کارپوریٹ جاب منٛز تِم چھِ أکسٕے جایہِ بیٚہوان واریاہ ؤرٕک سٹرٛٮ۪س تہِ چھُ لایف سٹرٛٮ۪س تہِ چھُ many factors related to stress. Do you see this as an aggravator in your disease when it comes to neurological elements?
Terrible. Now, sir, I have seen the world from a different. Which is, if you see what are the major problems in the world which affect health, actually, climate change will be affected. That it will be low lying. Will have sea will go up. The temperature will go up. Biological life will be different. This is the sign. The bigger sign is every section of people is stressed now. Stress of failure, stress of success also.
Stress of proving yourself.
Absolutely, that is worse than the other thing. Har kanse nuclear family chhe zai bas chhe timan mas rozun cohesion for long decades, one or two children only, and you see, and then elderly, their children away alone. This is worse than climate change.
Yes.
And this will be the main public health problem, and is still in every country in a different way. Students, adolescents, pressure of exams, pressure of proving themselves, pressure of professional life, then the huge private sector. Sign a private sector. Government nokriya kare beche to shamas aaye ghar. The stress on people who work privately is terrible. They think tomorrow, what will we do tomorrow? Some of them who succeed, they also have to prove कि वंगो सुथी रोजन हमेशा यम काम च वंकर खसा और यमन ज़्यादा काम च वंकर वाता और. You know, you have seen it yourself. You belong to the age where you see it very closely.
Absolutely,
with your
Doctor.
friends
I see it very closely. That is why I asked you.
Colleagues. This is as big a public health problem. It's not an individual. It's a public health problem.
So, stress इच कथ कर अस डॉक्टर साहब येल्ले कहीं स्ट्रेस आइस पच्छ वनान कि I have slight headache. Unfortunately, people have a habit of self-medication. Right?
True.
सर में दर्द हो गया तो दवाई खा ली. People are not wanting to sleep, or maybe नींद नहीं आ रही है तो दवाई खा ली. They call a friend, और कोई कह देता है कि नहीं तू ये दवाई खा, मैं भी खाता हूँ, मुझे अच्छी नींद आती है इससे. How detrimental it is, doctor?
Very much. See, you have to understand, the stress is there. The treatment is somewhere else. How can you medicalize it?
Yes.
See, people come to us with बच्चा जी चक्कर आ रहे हैं तिकाज गो ना फेल या टीचरन वनस क्या था या लाइक कुरहोस न अमसुन फ्रेंड्सो कोर ये
peer pressure है बाकी चीजें हैं.
It's how can you medicalize it all the time and give drugs for it? It has to be treated at a family level, at a social level, at a counselor level. ये कसु छु वनी काम आइस. These things are not coming up. They think everything, psychiatry, neurology, physician or something, or depends on the what symptom the person has. You say backache ko tum stress ho backache kasam dusra se ortho feras. I agree, ortho has to still see it, but many times backache, chronic backache has lot of anxiety with it. See, the point is the treatment has to be by the people around and the place where he is working. That is important, not doctor and drugs all the time.
इतने सारे पेशेंट्स.
Purpose, people, place, purpose, rather than doctor and drugs.
You see a lot of patients, डॉक्टर साहब. क्या पेशेंट्स की एज कम हुई है आपके पास जो आ रहे हैं? लाइक इनिशियली आप पेशेंट्स देखते थे मे बी अबव 40, आज उनकी जो एज है ड्रास्टिकली कम हो गई है. 20+ पेशेंट्स भी आ रहे हैं आपके पास, या मे बी 18+ पेशेंट्स भी आ रहे हैं. तो what is your overall observation on
young
this?
patients तो हमेशा आते थे because of the illnesses they get for head
No, but
injury.
I'm talking about.
No, but elderly when जाती हैं. We have huge geriatric patients now, and children who may not have major problems, who have developmental delays or speech delays or behavioral disturbances or just being angry, impulsive. Parents get perturbed with that. They also want to medicalize that small little thing.
Which is not needed.
probably not needed every time. They need more of knowledge and counseling.
सो वन मोर क्वेश्चन विच इज़ वेरी इंपॉर्टेंट कि आजकल के दौर में हम जब देखते हैं कि इतना ज़्यादा स्ट्रेस है लोगों को और जो डॉक्टर्स आपके पास जाते हैं पेशेंट्स, आपने कहा कि नॉट एवरीथिंग नीड्स टू बी मेडिकलाइज्ड. इसके बारे में आप क्या लोगों को कहेंगे? बिकॉज वी सी दैट वी अनफॉर्चुनेटली हैव अ टेंडेंसी ऑफ हैविंग मेडिकेशंस और सीइंग अ डॉक्टर just in a flash.
Just in a flash.
जी.
I think most important thing is public health knowledge. Public health. I think people like you have to